Hi, good afternoon, everybody. For those of you who don't know who I am, I'm Brian Sarandria, the assistant principal here at Wheatley, and I guess Karen Clapper used to put this together every year, so I inherited it from her, the annual training. So what we're going to have today for you is a couple of different presentations, starting off with Stephanie from BOCES, who's going to go through the right to know, de-escalation, workplace violence, no, not workplace violence today, but
That's for September.
but a few different presentations, the annual ones that you've probably seen before. And then at some point, there'll be a break first for some of the clerical and monitor crew, and then Michelle Gross will have a presentation, followed by Sean O'Brien with the DASA presentation, and then Corey Kindleman with the acceptable use policy presentation. So a lot of presentations for you. There is a sign-in sheet. From what I understand, the monitors all met at their respective buildings, except for here, prior to this. So I believe there was a sign-in there. However, there is a sign-in sheet for clerical going around that, although it only has the Wheatley names on there, please add your name to that and sign in. And if for some reason you were not at your home building prior to this, then you can sign in on that one of those sheets as well. And I know Lance had his own sign-in for facilities crew. Just to ask also when this is done that the monitors and security from Wheatley can just hang back so we can touch base on a couple of things for about 15 minutes. I'm going to the Met game tonight, so it won't be that long. So, yeah. So enjoy and thank you.
Good afternoon, everyone. So I'm going to start off with de-escalation. I know some of these trainings, if you've been through it last year and the year before with me, it gets a little dry, gets a little boring. I'll try to get to just the stuff we really need to go over, since you guys have a full day of a lot of different trainings you have to go to. So really, we just want to make sure that we're going to go through for de-escalation, that you just recognize when something's escalating, common triggers, when someone is becoming at an agitated state or becoming aggressive, and what you can do when you're forced to intervene in a situation with an individual. So we want to know when it's important to develop strategies for ensuring personal safety in potential problematic situations. So in any conflict, you have a choice. You can escalate the incident further, or you can de-escalate the situation. So we want to say, how would we manage conflict? So we have a personal strategy for doing that. Personally, we've either learned it in childhood, or it's how we just function automatically. It's what we just default to naturally when we're dealing with other individuals. They say your safety may depend on your conflict management style. So you have the 7 stages of behavior escalation, right? Someone who's calm, cooperative, when someone's triggered, personal experiences, unresolved conflicts, things that may happen, then trigger that person to change their behavior and then to escalate. Agitation, when someone's personally increasingly upset. Acceleration, conflict remains unresolved. The person focuses solely on that conflict. They peak, so the person becomes out of control. They exhibit severe behavior. Then we have de-escalation, so where they vent in the peak stage, person displays confusion, severity of peak behavior subsides, and then the person then displays a willingness to participate in the activities or whatever it is that you're trying to get them to do. So there's different traits and factors that may trigger aggression, right? So we have them listed here. We have certain feelings. If someone feels powerless, they have fear, grief, they feel like there's a feeling of injustice, boredom, they feel humiliated in some way, shape, or form. There may be some substance abuse, some psychiatric illness, a history of violence. They're in highly stressful situations, right, depending on what is going on in their home life. And there's different ages and factors that tribute to that. So they say they look at age, and mostly, especially males, is what they say in ages 15 to 40 that have factors that trigger aggression. So common signs of someone who's agitated, right? So when we're speaking with someone, they're becoming agitated, they raise their voice, they're becoming high-pitched, they speak very rapidly, they're pacing, they're sweating, they're using their hands a lot, and it could be sometimes in an aggressive manner. They're fidgeting or shaking, they're using their fists, very erratic movements, their posture changes, and even their words, they're verbally becoming abusive. So what is verbal de-escalation? It's an intervention for use with people who are at risk for aggression. It is basically using calm language along with communication techniques to diffuse, redirect, or de-escalate a conflicting situation. So this may or may not be situations that you commonly are going to encounter, but if you ever find yourself walking the hallways, you find there's someone in the hallway that you've encountered, it's another parent, it's a parent or a visitor to the building, and you ask them, oh, what is the purpose of their visit? They seem lost, you're trying to figure out, and they just, you find that maybe the individual is not supposed to be there, you're trying to redirect them maybe to a classroom that they're supposed to be in. Things can happen throughout the course of your workday that you may encounter this situation. So this is where we want to just make sure we know that there's certain techniques involved that can help in a situation if you encounter someone who is becoming upset where you're trying to get them to go in a specific direction, right? So physical force and de-escalation, you never want to consider that. You don't want to use physical force as your first response. It's a last resort, and it's just a last resort to essentially prevent injury to yourself or really to another person. It usually results in someone getting hurt if that's going to be your first instinct. So we have different aspects of communication. We have body language, tone, and word choice. When we look at those three different options, we say which one has the most influence, right? So your body language, nonverbal. Are you making eye contact? Is it your posture, your gestures, your facial expressions? If you're working toward at the front desk and a visitor comes in and you're speaking with them and they ask you a question and you roll your eyes, that immediately to the other person, depending on what state they are in, can trigger that person to then become agitated or upset in some way. So we want to be aware of the body language we're using. Even when we're talking in a way with our arms crossed, it may come off as that we're being closed off to whatever conversation we're having, as opposed to you standing there and being open to a conversation with someone. Your tone, your choice of words, how you would say it, your pitch, your volume, your emotion. You can ask me a question and I could say yes, but the way I say yes could either sound like I'm either totally annoyed by that yes, or I'm enthusiastically saying yes, right? So depending on how you're saying something to somebody and how they will interpret it will then make them respond to you in a certain way. So we want to be mindful when we're communicating with other individuals, how we're using those three things to communicate with someone. Our nonverbal communication, right? So we're looking at this person. What is her body language saying, right? She's pointing. The pointing can come off as maybe being aggressive. Her arms crossed can come off as being closed off to the conversation or to the individual that's trying to address them. They don't want to be bothered. And the hands on the hips almost might come off as, I'm at a point where I just don't want to be dealing with it. I may look like I'm annoyed by standing in this way. Body language can escalate the tension, right? So we talked about this. So we have, your shoulders shrugging can make it seem as though you're uncaring or unknowing. You have your jaw set with clenched teeth. It can come off as you're not open-minded or that you're not listening. If you're pointing at someone, it could come off as accusatory or in a threatening manner. If you're showing that you have a fake smile, it could come off as though you're mocking the person who's speaking with you or that you just don't really care about what it is that they're trying to talk to you about. You have excessive gesturing, pacing, fidgeting, or weight shifting, and that can come off as anxiety. I know myself as I'm standing here, I am kind of shifting my weight a little bit because I am a little bit anxious about doing this today, right? I'm going to be talking for a little bit with everyone. I get in my head a little bit about it, and I'm up here and I'm talking, and I know I'm shifting my weight a little bit. I kind of keep moving back and forth, but I can't help it, right? So this is my body language, right? So this is how it's coming off. It's not a bad thing, right? everyone does it, but just to show you that even without you realizing it, it's happening. As I'm saying it, I'm realizing this is exactly what I am doing. And touching, even when culturally appropriate, right? So we want to make sure, someone who's closing in on that space, you're getting too close to someone, you touch their arm, right? That could come off a certain way. That could come off as a way that may be hostile or in a threatening manner. I'm closing the gap on you, I'm getting really close to you. Someone might take that as in a threatening manner, right? So we want to, when we're speaking with people or approaching other individuals, especially when we're trying to get them to do something that maybe they don't want to do, right? So someone's visiting the building and we don't want to allow them access, or we want to make sure that they're only here for a specific reason, or they're only supposed to go to a certain wing of the building, and we're trying to direct them that way, and we want them to do what it is that we're asking them to do. We want to try to look as non-threatening as possible, right? So we want to appear calm, self-assured. Even if you don't feel like you want to come off that way, right? So you may be thinking it, but you want to make sure that what you're projecting is that you're calm and self-assured. You want to maintain limited eye contact, maintain a neutral facial expression, place your hands in front of your body in an open, relaxed position, and you want to be at the same eye level, and you want to encourage the person if you're trying to have a conversation with them. So if you're somewhere, like if you're in the main office and they're waiting to be seen or spoken to, you encourage them to be seated. If they don't need to be standing up and waiting, they may be doing that whole pacing thing, right? Which would then, throw off you're reading their body language. Then you say, okay, you could take a seat while you're waiting, and have that kind of conversation with those individuals, right? So we look at these pictures here. One is more aggressive and one is less, right? So which position is less aggressive and why? So we have the one on the bottom left. She's standing there, her hands are closed in front of her, standing kind of close. It doesn't look aggressive, but to the other individual who is standing there with her arms open and with like more relaxed gesturing, it may come off as aggressive to the other individual. As opposed to the one on the top right, they're mirroring each other's body language. They're both kind of standing there, relaxed, open to having that conversation with each other. There's a little bit more space between them. They're more comfortable. It looks like they're both comfortable in that conversation. Right? You never want to turn your back to someone, especially while they're in the process of speaking to you. You want to maintain at least 2 arm lengths distance from a hostile person, and you want to casually position yourself. So let's say you're in a position where you're in an office, you're behind a desk, and you see that someone else is becoming upset. You want to make sure you maintain that position. You don't want to come out from that desk and kind of close that gap with you and that individual, and then you're bringing that person in closer to you, right? So if you have other kind of barriers, you want to use that to your advantage. At the front, we have the visitor desk where you're talking to that person. If you're speaking with someone who you don't want to necessarily allow access to the building, and then you come out from around the desk as opposed to continuing to speak with them, it changes the way that feels to the person on the other side when you're speaking to them, right? So we want to be mindful of that. You have, there's different types of personal spaces. So there's intimate space, casual space, social space, and public space, right? So there's different amounts of space that you want to either share with someone, especially if it's, let's say, a stranger coming to visit the building. You're not going to have that closer space, that intimate space of 1.5 feet, right? You're interacting with someone, you're speaking with them, you're trying to gather what they're here for, what it is that they're trying to, what information are they trying to portray to you to gain access to the building, right? So we would put more space between us. Violence-prone individuals perceive the need for wider territorial space in order to feel comfortable, right? So the more space someone has, the more comfortable they feel. But at the same time, if I'm having a conversation with someone and I'm standing all the way back here and you're trying to speak to me, it also seems like then I'm also uninterested, right? So we want to be mindful as to how we are approaching other individuals. So reflection question, how might you feel when another person has different spatial boundaries than you do? how will you address your own spatial boundaries? I'm sure we've all been in situations where this has happened to us, right? Where you're in a public space, you're waiting online, and you have the person that's behind you waiting online. You've left a lot of space in front of you because you understand that personal space, but the person behind you is so close to you that no matter how many times you kind of move up, they're still right there. There's sometimes when you're out in public, there's just individuals out there that don't understand personal space. So we want to be mindful of how do we approach that situation where someone may be encroaching in our space that does make us uncomfortable, and how do we say that to them? We don't want to come across in a certain way, because then we may trigger that individual, and then that will then trigger them to kind of, and then you end up in a situation where there may be, words exchanged or something that then you ultimately feel even more uncomfortable, and then the other person responding to that, right? So we want to be mindful about how we say things, right? It's not what you say, but how you say it. We can express our feelings or our attitudes, right? We have to make sure that the tone that we use with individuals can change the way they would react to what we are saying to them, right? So we could say the same sentence and we could say it 5 different ways, and each one of those ways is going to elicit a different response from an individual. So it says, you made it here on time. I could say it like, I'm excited, you made it here on time. Or I could come off very sarcastically and like, oh, you made it here on time. It may sound like I am coming off as like, that's a rarity, right? So there's some people, and someone might take that as, well, what is that supposed to mean, right? So if you're saying something, you want to be mindful of how you're saying it. If you're saying it in a suspicious tone or a happy tone, it can come off patronizing, or even that you're irritated when you're saying it, that they say, oh, is that individual mad at me? I'm not sure, right? Which would then make them respond to you in a way that you would then have to say, why did they say that to me, right? So we want to be mindful. It's not what you say, but how you say it. We have our tone, right, and how you're still stern, timid. Is it very lowered voice? Is it a raised voice? Is it coming off as angry? Your volume, how loud are you being? Is it overpowering to the other person to the point where they feel like they're kind of like shrinking back a little bit? Is it too soft and almost like to the point where like unassuming, you seem fearful in the conversation that we're having because of how soft you're coming across? Your rate of speech, whether it comes off like sometimes you talk to someone and you're like, oh, you listen to them speak, and you hear them and you're like, oh, their voice is just so soothing. I can listen to this person talk forever, right? So just the way they come off and the way that their canter is, how controlled they are when they're speaking to you, right? And how polite you are. You want to be respectful. Obviously, if you're ever in a situation where you're encountering someone who may be upset, we're not going to do things like name calling and things like that. Please and thank you, and Mr. and Mrs., where you indicate respect to the other individual as well, so that they are aware we're trying to be polite. We don't want to get loud or yell over a screaming person, right? We want to wait until he or she takes a breath, or speaking calmly at a normal volume. So this could even be if you're answering the phone. Some of you are clerical, you get a call, it's an outside call, it could be a parent, it's an upset parent, they want to know why something is happening, and they're already yelling at you on the phone, right? You don't want to be that you're yelling back at them or interrupting them. That could just initiate the other person as a trigger to escalate them even further. When someone is loud or screaming, we want to make sure, let them get it out, let them speak, let them finish their thought, let them get the whole thing out, and when they take that breath, you begin speaking, but you maintain that calm, normal volume, right? We want to maintain that on our end, no matter how much that person's voice goes up, right? We want to maintain that normal, calm response. We could always respond simply, right? It's either yes or no, or we could say, oh, I'll take the information, or whatever it is that the person's trying to convey to you. You could say, listen, I understand you're upset. Let me take your information down, and I'll have the appropriate person call you back, right? But we're doing that in a calm, managed voice. We can repeat that, so if the person doesn't like what they're hearing sometimes, they'll just keep going, but we can repeat our response until they understand what it is that we're saying, as long as we remain that in a calm state. And we answer informational questions, even if they're rudely asking us, right? So the person on the other end may be coming off as rude. They're upset. They want to know what's going on with their child. They're coming off as rude. But we would continue to answer, and we would answer in that calm tone, right? So then we have verbal de-escalation tips, right? So we want to make sure we're not coming off as defensive. We're being honest in our answers, right? So we won't want to come off, if it's not something I can help you with, I will not say I can help you. I would say, let me find the person that I can help you, that can help you. That may be a call back. That may be you being on hold. But that's how I would communicate exactly what that is with that individual so that they understand. There's limits, there's rules. Someone who's trying to gain access to the building, if they don't have an appointment or a reason or purpose for their visit, they just know that their son, daughter is upset and they just want to get into the building. Please just let me in. I know they're upset, but no other reason to visit. But we have rules, right? We have limitations on why a person can gain access to our buildings, right? We want to make sure that we're explaining what those limitations are and why, and we outline that for those individuals, and we have those conversations. We want to be respectful. We want to empathize with their feelings, right? So we want to say, I understand your son, your daughter, they're upset. And then you could try to find a resolution for them. Someone could call them back to speak with them. You can see what the proper channels would be for someone to get in contact with that person, but it still wouldn't be gaining access to that building, right? So we want to make sure that we're empathized with feelings, not behaviors. We're not going to say certain behaviors are okay, even though you may be feeling a certain way. Suggest alternatives as well. So we want to reduce the level of anxiety to encourage the possibility for discussion, right? So someone who may be upset, irate, they're talking to you, they just want to gain access. Their little son, he left school today, he got on the bus, he was upset, he texted me, he's even more upset. Someone took something from him, he can't find it, and now he has a test later on. I know he's upset, I just want to speak to him. Please, just let me in. But having a conversation or having the appropriate person to have a conversation with that individual can help try to reduce the anxiety to encourage the possibility for discussion, right? So we can have conversations with that individual to try to bring them down and have those conversations. But if a person is so enraged that you're trying to reason with them, sometimes you'll find that you won't get anywhere with them. So knowing the limitations of that as well. Use minimal encouragers, right? So brief, nonverbal head statements, positive head nodding. Simple verbal responses, like, okay, I see, I'm listening. That encourages the person, minimal encouragers demonstrate to the person that you are actively listening and paying attention without stalling dialogue or creating any undue interruption to the individual, right? So it shows that we are hearing what they are saying, we are understanding what they are saying, and then we can exchange conversation from there. When you've actively listened to someone, then you could say, you turn around and say, listen, I understand, this is what you're looking for. You would like to come into the building to see your son, but then you would then go on to explain to them, these are the rules of the building, and then go on from there so that you cannot allow access. So that would be one of those things. But you want to make sure that you're showing evidence that you are actively hearing that person by repeating what that person has said to you. You want to keep it brief, and you never want to interrupt the person because that could escalate them a little bit further. When you are interacting with someone who may be getting a little bit more irate or escalating as you're having conversations with them, you want to use open-ended questions. So you allow yourself to get more information from the person, what it is that they're really looking for. So they may be upset, they're coming to the building because their child's upset and they called you and all of these things, but there may be something else at the root of the issue why they're really there that then you can get to that down to in that conversation. By asking those open-ended questions, it allows room for that person to put that information out there so you can kind of gather what it is what they really are looking for to get an end result in that conversation. All right. So these are all the things that we talked about today, and de-escalation. I'm not going to go over those pieces again. But you remember, there's nothing magic about talking someone down. You are transferring your sense of calm, respectful, clear limit setting to the agitated person in the hopes that he or she actually wishes to respond positively to your respectful attention, right? So do not be a hero. Do not try de-escalation when a person obviously has a weapon. In that case, then you would simply want to cooperate. But there's also going to be situations where you feel that you've exhausted everything that you've learned and you just can't seem to get that person to come down to that level where you can have that conversation. And knowing when you've reached that point, say, you know what, let me get someone else who can help you. And even though the other person will come in and say the same exact thing that you've said, because it's just a different person now, that might be enough to bring that person down, because at that point that might trigger something in them to say, you know what, we're not getting anywhere here, let me bring it down. And the person could say the exact same things you were, and magically the person's calmed down and they were able to get somewhere in a conversation with them, right? So sometimes there's just limitations to, I was the first person they encountered, that's when they were the most upset, and I wasn't able to bring them down, but someone else was able to do that too, and that can happen. Anyone have any questions about de-escalation before I move on to the exciting topic of right to know? All right. Okay, so right to know comes from our hazard communication training program. Hazard communication standard gives employees who work with hazardous chemicals a right to know about chemicals, the chemicals that they're working with, right? I know we have custodial in here, we have different groups. They're the ones actually working with the chemicals, and then we have clerical staff, and you guys are saying to yourself, I don't use that stuff. Why am I sitting here? Simply because the same reason why the teachers go through it, these are chemicals that are being used in your workspace. So you go through the same training because this way you are aware, because these are chemicals that are being used in your workspace, and then you come into contact with those chemicals, you also have the right to the same information as the people using the chemicals, because you have the same impact that can happen to you as can happen to them. Maybe on different levels, but it can happen, right? So we want to know what those chemicals are, their associated hazards, what individuals can do to protect themselves, how we handle and store these chemicals, how to respond to hazardous chemical emergencies, and who do we contact for information, right? So employers must develop a formal written plan, which includes employee training, and this is also often referred to as a HAZCOM program. You might hear it as just right to know or hazard communication plan. All right, so we have 3 laws that affect us when putting together this program. They assure access to information about the chemicals. They require annual training. They require timely responses to employee information requests. They require contact information via the right to know poster, which I'll show you an example of in the presentation. There must be one in each building. They provide employee protection against discrimination for exercising his or her rights associated with these laws. So no one can essentially come after you for asking questions about these chemicals. It protects you. This is an example of what the right to know poster looks like. At the very bottom, it usually has either your director of facilities information or your head custodian information, or both, with a phone number, email, some sort of contact information. Okay. So districts, in order to be compliant, they must have a written plan. They have to designate an individual to be in charge of this program. So in your case, for this district, it is Lance. He is in charge of this program for the district. He conducts an inventory of all hazardous chemicals in the schools. He obtains all the safety data sheets. He has them in binders. They're each in each individual school building and they're available to employees. We train the employees on how to read a safety data sheet. I have an example so you could see how you would read one. And we provide personal protective equipment for anyone who's using these chemicals. The GHS is how you would read the the way the chemical is listed. So what they have is this is the way they classified it. Essentially, it used to be, like they used to call it safety data sheet. Beforehand, it was called like a material safety data sheet. And essentially, they changed it to this system so that no matter where a chemical is manufactured, where it comes from, or who's manufacturing it, all the information would always be in the same place. So no matter where it came from, you're always going to find the precautionary statement in the same spot, the hazard statement in the same spot, the pictograms in the same spot. Prior to this system, it was that they were required to put it in there, but they could put it in any order. As long as it was there, that's all that really mattered. And that made it difficult because you figure you have your custodian who may use 5 or 6 different chemicals in a work shift, and now they're trying to find information. If you're trying to find information, you're trying to find it rather quickly. And you don't want to, if you're using different chemicals and you're finding it in different spots, you're now delaying whatever information you're trying to find, especially if it's something that's under for like an emergency, right? So they expanded it to 16 parts. They're all in sync, and they all must have these labels, right? So we have hazardous chemicals. We refer to all chemicals as hazardous chemicals. There's some sort of hazard. Even with our green cleaning products, it's a lesser amount of hazard associated with the green cleaning product, but there is always some sort of hazard associated with it, right? So that's any chemical that can do harm to your body. We have something called subpart Z chemicals. We don't use them in districts, but we do have to use them. We have to talk about them as part of the training today. But they're not substances that are used within a school district, but they are out there. They're very hazardous. And they must be documented when they're specifically being used, right? And then employees use chemicals. Whoever uses chemicals must have access to the safety data sheets and the warning labels for any chemical that they're using while they're at work. Okay. So the hazardous chemicals effect. Certain chemical has on the body depends on different factors. So you have the physical form of the chemical, how the chemical enters the body, the amount of chemical that enters the body, also known as the dose, and how toxic or poisonous a chemical can be. These are the different ways a chemical can affect an individual, especially someone who's using a chemical. Inhalation, ingestion, absorption, contact with the eyes, injection. It's listed in the most possible way to happen to the least possible way to happen, right? So a lot of times we're using sprays, spray cleaners, things like that. It's an aerosol. It accidentally gets in our eyes. We breathe it in because now it's in the air. We're spraying a lot, and then we end up breathing it in. Or we're spraying it, and it gets on our skin, and then it's getting absorbed into your skin. For the custodial staff they're using their PPE, or they should be using their PPE, and sometimes you can have a rip in that glove and you don't realize it, and you're using something that's being absorbed into your skin, and then you find, you're like, why is my hand itchy, or whatever, then you say, okay, let me refer back to the safety data sheet to see if it's something that is an irritant, right? So that is why we look at the different routes of entry when we're working with chemicals. We have different health hazards associated with chemicals. They do fit into different categories. These are categories of chemicals that we generally don't, a lot of the chemicals are green cleaning products. They don't fall into these categories, but again, we do have to discuss them. So we have carcinogens, teratogens, mutagens, and sensitizers. They either cause cancer or birth defects or what else does it say? An allergic reaction, or that could be deadly depending on how much of a dose you use, right? So you think about different types of chemicals. You use too much, it can be considered a deadly chemical. We have chemical exposure limits or permissible exposure limits or threshold limit values. They are based on an 8-hour time period. Levels must be kept below these limits for safety, and employers must have an obligation to monitor many of these chemicals or use historical data to estimate these. the PELs. So a lot of times what we're doing is, especially the custodial staff, they'll be working with something, but it's in a space like this. There's no windows. So, but you're using a chemical that may be strong in scent. You want to make sure that you're ventilating the space, right? So we're opening the doors. We're using what we can to make sure that we're able to vent out that smell or the amount of chemical that might be accumulating in that space, right? If we're in a space that has windows, we're opening those windows to create ventilation. Right, so we have our custodian, they do different things, cleaning, stripping floors, building repairs, but they also work with many different types of chemicals. We talked about PPE, right? So your custodian should be using their PPE. They should be aware of what PPE that they're using for each specific type of chemical. If they need gloves, mask, if you're someone who's working out in the, outside, and your maintenance, and you're working with loud machinery, you're using your PPE, you have those earplugs in, or like your eye shield, so that if you're doing anything with the grass, anything that can fly up and hit you in the eye, things of that nature, you're aware of what PPE you have. You want to make sure that you're able to access your PPE, and also you want to make sure, especially for my custodians, that you know how to use your PPE. You want to check the integrity of the PPE before you're using it. Sometimes, especially like some of your plastics, they sit for too long. They start to disintegrate over time. Things maybe not have come back from the manufacturer properly, right? So things might not be cut exactly the way that they're supposed to. Check it before you're using it. If you're putting gloves on, make sure that they're perfectly intact before you're putting them on. Sometimes we open a box, and because of the way it was opened, some of them may be ripped. And then you put the glove on, and there's rips in certain spots. It's okay, I'll use it anyway. No, throw them out. Sometimes we get used to doing the same job duties over and over and over again, and we become desensitized to those things. Oh, I'll just do it. And you don't grab the gloves, and you just start doing whatever it is that you're doing. No, grab your gloves. Be mindful. The district is only required to provide you your PPE. You're the one in charge of using it, right? So you're the one that has the control of whether you're protecting yourself or not. So you have it there, use it, make sure you're using it. If it's not working for you, bring it to your facilities director's attention. If it's running low, you bring it to someone's attention. We need more, bring it in, please. Whatever it is that you ordered last time wasn't working good, can we find a different option, right? Have that communication. Your PPE is your first line of defense for yourselves. All right, so we have our chemical labels. The custodian learns what products he works with, and he needs to know that they come with a warning label. He must make sure that he knows which chemicals he's working with and which labels go with what. We want to try to leave all the chemicals in its container that it's come in whenever possible, but sometimes it comes in a large jug and we're breaking it down to a smaller bottle. If you do put it into a new container, we want to make sure that everything is appropriately labeled. We don't want spray bottles that just have the red Sharpied X on it, and we know that means whatever chemical because we use that on the desks, and the one with the black Sharpied X is something else, and we use that in a different way. And we know that because we've labeled it that way, but it needs to make sure that you have the appropriate labels on them that come from the manufacturers to slap onto those bottles. Okay, if you don't have them, make sure you let your supervisor know so that those labels can get ordered and put onto those bottles as well. This is what they should look like. It has that information on there. So your precautionary statement, signal words, pictograms, and information for the manufacturer. This is an example of all the different pictograms that you would see on a safety data sheet. I'm not going to go through each one, but you see that these are all the different types of, and then we have PPE, examples of PPE. Physical hazards, environmental hazards. So we have the example, that's your product label, that's your safety data sheet. A safety data sheet will have the manufacturer's information. It'll have the precautionary statement. It would have the hazard statement. It's going to have your pictograms and your routes of exposure. And then if you've had an exposure, it tells you what to do. Eye wash, rinse the skin, wash your hands immediately, tells you what to do. Then you can contact the manufacturer for additional information. But all of that's right there, and you'll be able to find that on that safety data sheet, usually in the very beginning. There's 16 sections, there's another like 10 sections of other stuff, and half the time we're not looking at that stuff because we just want the stuff that really affects us in that moment of time, right? So that's where we would find it, mostly on that first and second page. Safety data sheet, formerly material safety data sheets, it has those 16 different sections. It tells you what chemicals are in the product, what the hazards are of the chemical, and how you protect yourself from that chemical. So if you're using something that's an aerosol, it may tell you you need, like a face shield or whatever it is, depending on what kind of chemical it is. So these are the different sections that you would see on that safety data sheet, and you see the first like 5 really are the ones that you would be when you're directly affected by a chemical, 6, 7, and 8 as well. And as you get further down, it's really if you're just like handling and transporting and disposing, that, that kind of information. Protecting yourself. So you want to use the smallest amount of chemical to do the job. You want to maintain equipment to prevent or minimize leaks or release of chemicals when it's not necessary. Handle chemicals according to provided directions, and you want to make sure you're always using the proper PPE for the chemicals that you are using, right? So you read that safety data sheet, it tells you use your gloves and a face shield. You want to make sure that you're using your gloves and a face shield. All right, so this just kind of summarized everything we went over today. Does anyone have any questions about any of these points? Right to know, something that you thought about for de-escalation that you're thinking about now? I'll take questions, any question. All right, so as far as the clerical, this is your break. I'm going to do bloodborne pathogens with the custodial staff. So unless you're custodial, you don't have to stay for this, unless bloodborne pathogens just sound so intriguing to you that you must stay. But you don't need to. He said that there was more like speakers after me, but I wasn't sure like who that pertains to.
How long is your...
This is probably going to be like 15, 20 minutes time.
Okay, great, thanks.
All right, bloodborne pathogens. If you're here, that means you're staying for it. All right. Bloodborne pathogens. The standard became effective in 1991. It means it's been here for quite some time. Okay, it's been revised and amended over the years. 2001. It included provisions for needle stick and safety prevention. And then this standard prescribes safeguards to protect workers against health hazards caused by bloodborne pathogens. The requirements are exposure control plans, standard precautions, engineering and work practice controls, PPE, housekeeping, hepatitis B vaccine, post-exposure, follow-up, hazard communication, and training and record keeping. These are examples, right? So we have hepatitis B, hepatitis C, HIV, are different microorganisms in the blood that can cause diseases in humans. Okay, exposure to any of these three pathogens is possible through needle stick or other sharp-related injuries, as well as contact with blood or other potentially infectious materials. Okay. So we'll start with hepatitis B. For you guys, this is what poses the greatest risk of infection. It is a very strong pathogen that can survive outside the body. Hepatitis B can survive for at least 1 week in dried blood on surfaces or contaminated needles and instruments, meaning if a student has a nosebleed and their blood got on that desk, it can survive on there for that long. Okay, so it could live in that surface for 1 week before anyone realizes it. And you come into contact with it, you touch it, and you touch your nose, your eyes, your mouth, you've now created an exposure for yourself. Okay, so there is a hepatitis B vaccine that exists and may be acquired from most physicians. I know a lot of individuals who may have been born after, I don't even know what year it is, a specific year. Hepatitis B then was part of like their vaccination requirements. Like as soon as you're born, you get like that first dose. If you don't have it or if you're unsure, they can do a blood test to see if you've received the vaccination at some point in time in your life. And then you could decide to either get the vaccination or not. Okay. It is made available to all employees. So if at any time you feel that you want it, you've never got it, you're unsure, the district does have their own physician that they employ that they would then send you to go through this process to do that. Okay, there's also treatment options available for hepatitis B. Hepatitis C is spread by contact with blood or bodily fluids of an infected person. This virus has a long onset of symptoms, and its primary target is the liver. There's many people infected in the United States that have no symptoms and don't even know that they're infected until decades later, when liver damage shows up, and then they figure out why, and then they say, well, it's because you have hepatitis C. For this very reason, CDC has urged everyone born to be tested between a certain time, 1945 and 1965, because hepatitis C does not have a preventative vaccine. However, there are treatments for anyone who does have it that do successfully treat and manage hepatitis C. Okay, then we have HIV. Can be spread by contact with blood or bodily fluids of an infected person. HIV is the virus that leads to AIDS. It does not survive long and cannot reproduce outside a human host. This is why in the workplace it gives you the least, it's your least probably thing that would probably be your level of infection. It's more your hepatitis B that provides the most risk to you. We have Zika and Ebola virus. Those can be transmitted through, mosquito or, they circulate in the blood and for prolonged periods of time and therefore are capable of being transmitted through the blood or through other OPIM. Okay. Bloodborne pathogens can be transmitted through a number of body fluids, including the following: blood, tissue, semen, vaginal secretions, spinal fluid, fluid around the heart and lungs, and your saliva, which is hepatitis B only. Okay, your types of contact, right? So you have indirect contact. It's a person who touches an object that contains the blood or bodily fluid of an infected person. Then you have vector-borne transmission. You're thinking more of like your mosquitoes, your ticks. Your skin is penetrated by a bite of another organism carrying the disease. Your respiratory transmission, it's a person inhales respiratory droplets from an infected person, like through cough or sneeze, right? Now when I hear that, I think COVID. And then direct contact, infected blood or bodily fluid, mucus from one person directly to another. Okay. Our methods of exposure. Your unbroken skin forms an impervious barrier against bloodborne pathogens. However, infected blood can enter your system through open sores, cuts, abrasions, acne, or any sort of damaged or broken skin, such as sunburn or blisters. Bloodborne pathogens may also be transmitted through the mucous membranes of the eyes, nose, and mouth. So for example, a splash of contaminated blood to your eyes, nose, or mouth can result in a transmission, okay? So we have our exposure control plan. It's designed to identify, in writing, tasks and procedures as well as job classifications where occupational exposure to blood or OPIM occurs. Okay, so this evaluation should be done without regard to personal protective clothing and equipment. Okay, it must also set forth schedule for implementing other provisions of OSHA's bloodborne pathogen standard, and specify the procedure for evaluating circumstances around exposure incidents. The plan must be accessible to employees and available to OSHA and PESH if they were to come in, and employers must review and update it annually and more often if necessary. Okay, it's important. It's important because it helps protect workers from exposure, and by protecting the workers, then a district or an employer then controls its exposure incident costs, right? So one helps the other. An exposure control plan, it's meant to be a living document, so it could change over time, and it's used as a source of information for answering any bloodborne pathogen-related questions to help ensure exposure control activities are in place. Okay, so what else should you know? It must be written specifically for your facility. It must be reviewed annually, and it must be readily available to all employees. Employees must be regularly educated on the exposure control plan, where it's kept. So a copy is kept in Lance's office in a binder, where you can look at it at any time if you ever were curious and wanted to see it. You could ask him. Standard precautions and controls. So being exposed to potentially infectious materials does not mean you will contract a disease. Nonetheless, practicing exposure controls or strategies when anticipating bloodborne pathogens will not only help you avoid contracting a disease, but will keep you from worrying about a possible exposure as well. So what does this look like? You have standard precaution, engineering controls, and administrative controls. Okay, your standard precautions. It's a proactive approach to infection prevention. It means treating all human blood and certain human bodily fluids as if there were known to be infectious with bloodborne pathogens. So they're saying to be more safe than sorry. So essentially, if you're called to a room, kids had a nosebleed, you now have to clean it up, you want to always approach that situation as you know it's infected blood. So you want to make sure that then you are approaching the situation in that way, so then you would ultimately then make sure you're using your PPE and stuff like that, right? So you want to, we want employees to observe standard precautions to prevent contact with the blood, treat all blood with appropriate precautions, such as gloves, mask, gowns, if blood exposure is anticipated, and then using your engineering and administrative controls to limit exposure. Engineering controls are physical changes to the work area or process that effectively minimize a worker's exposure to hazards. So using a sharps container, or those self-sheathing needles, the ones that they close themselves, or needleless systems. Then we have administrative controls, and that's doing things like not storing your food and beverages in the same place that you store chemicals. It's using an instrument to pick up sharp objects that need to be cleaned up as opposed to using your hands, right? So you want to make sure that you're being mindful and using different things. That's an administrative control. Okay. If you're responding to an area where someone is actively bleeding, you want to isolate that person to prevent exposure. You want to keep the person in one spot. You want to put on protective gloves and have the person themselves give self-aid. So in the example of a kid with the nosebleed, even though you're putting your gloves on to protect yourself, you're still not actively doing anything. Let's say you're handing them a bunch of tissues or whatever they're going to use, napkins, they would then apply the pressure on their own nose and then do that thing where they have to like lean forward and apply that pressure, but they're going to do that. You are not going to do that for them. They're going to provide self-aid, okay? You want to try to control the bleeding where the injury occurred, right? We don't want someone to go from here, my nose is bleeding, but I know the bathroom is just across the hall, but the blood's dripping, and then I leave from here and I now trail blood drops all the way to the bathroom where then I go to then provide self-aid. The person will stay in that one area to do that. And we want to limit access to the area where the injury occurred so that the area can be cleaned appropriately, disinfected, and that others are then not exposed to the blood. Okay. Your PPE, right? So we want to make sure that we know when the PPE is necessary, what kind is necessary, how to properly put it on, adjust, wear, and remove PPE, limitations of the equipment, proper care, maintenance, useful life, and disposal of the equipment, and to inform a supervisor of the need to repair or replace PPE. This is my big one. If you don't hear anything else I've said today, I don't care. This to me is like PPE. That's where you have the control. Use your PPE, use what's provided to you. Again, I said it before, I'm going to say it again. The district is only required to give you the PPE that is necessary for you to use. If they decide to write you up or whatever it is because you're not using it, ultimately that would be the repercussions for it. But at the end of the day, you are in charge of your own use of your PPE. Use it. It's there for you. It's there for you for a reason. Use it. Handling decontamination and disposal, right? So if we're handling broken glass, we want to make sure we approach it as though we know it's contaminated and we do not pick it up directly with our hands. We use a mechanical means, such as like a brush and dustpan, tongs, forceps, right? Then we have our regulated waste disposal. That's those red bags. You know those red bags, the Sharps containers? We know where to find those red bags, right? Usually they're in the nurse's office. We're not using them to just pick up garbage. We're not using them unless the only time we will be able to use a red bag is if we're approaching a situation where we're cleaning up blood and now there's so much that we've cleaned it up and whatever I used is so soaked with the blood that if I were to squeeze it, it would just drip right out of it. That's when you would use a red bag. You're not going to use it because of gauze or anything like that where there's some blood on it. That could go in the regular garbage. It's only for those individual times. Okay? We want to make sure we're wearing protective gloves. Everything's cleaned thoroughly before applying the disinfectant. You want to clean and disinfect the contaminated equipment and surfaces using the appropriate disinfectant. You want to thoroughly wash up immediately after your exposure. And then you want to properly dispose of contaminated PPE, towels, rags, etc., in accordance with whatever the law states. But I will also say this, even during your regular work duty, if you're just cleaning and you have chemical, you use the chemical it got on the glove, you want to make sure that you're taking off those gloves the right way. You're not going to just take them and fling them and then take them off your hand, and when you flung it off, you've seen the spray of whatever was on there just kind of like goes wherever. You want to make sure you're taking it off. You're closing your hand into a fist. You're taking it off. You're sliding it off into your hand. You're folding the glove into itself. And then you take the other glove, hold it into its hand, the other hand, and you do the same, folding the glove into itself with the other dirty glove inside of it, and then you dispose of it that way, right? We want to make sure if you try to take it off too forcefully after a glove has been used, sometimes then it rips, it breaks apart. We want to make sure that you're doing it in a way that's not going to then give you an exposure from taking the gloves off, right? It can then spray, you get it in your eyes just because you had it on the glove and it just like came splashing off of it, right? So we want to make sure that we're thoroughly disposing of and taking off our PPE properly. We talked about the hepatitis vaccine. You can get one through the district if you don't already have one. There is a blood test to find out if you don't know. There's a blood test out there that they can take to see if you do, what vaccinations you do have, what immunity you do have, and to what. If you have an exposure, you want to wash the area, you want to flush any splashes. irrigate your eyes, okay? You want to make sure that no scientific evidence shows that using an antiseptic or squeezing the wound will reduce the risk of transmission. Okay, so using a caustic agent such as bleach is definitely not recommended. Additionally, you want to report the exposure to the person responsible for managing the plan. And you want to prompt reporting is essential because then in some cases then you have, if you need any post-exposure treatment, you then would then have to go through that process. You don't want to delay that. You want to go through and follow through with that immediately, okay? If you have a medical evaluation, it is considered confidential. It'll be documented. They identify and document the source individual unless feasible or prohibited. They'll collect and test blood. If it's needed, they'll prescribe medication, provide counseling, and then provide an evaluation for your reported illness. Okay, this is everything we went over today. Anyone have any questions about bloodborne pathogen? Anyone still awake? All right, cool. All right, thank you so much. That's all I had for you guys today. Have a good one. Thank you.
Hello. Hi, everybody. I'm Michelle Gross, the nurse here at Wheatley. I'm going to talk about diabetes, EpiPen, epilepsy, and bleeding emergencies. Okay. So diabetes. Type 1 diabetes is an autoimmune disorder in which a person's pancreas stops producing insulin. The insulin is needed to bring the glucose or sugar that's in the blood to the cells for energy. Besides elevated blood sugar, symptoms of diabetes can be extreme tiredness, extreme thirst, increased urination, weight loss, visual changes, and it could be unconsciousness if the blood sugar is extremely high. That's called hyperglycemia. Only insulin replacement can restore the blood levels to normal. Blood sugar needs to be monitored every day, several times a day. While in school, if I have a student who's diabetic, they will need to check their blood sugar before lunch to determine how much insulin to take. The other time blood sugar needs checking is if a student is feeling low. It's also called hypoglycemia. And very often now with technology and everything, there's been great advances with diabetes. A student will wear a device called a Dexcom, and it monitors the glucose throughout the day, and they'll get alerts if it's trending up or down. So I'm going to talk about hypoglycemia, which is low blood sugar. Symptoms are usually they'll feel sweaty, shaky, weak, dizzy, have a headache. The student will usually come to my office with a buddy or a teacher to be evaluated, or I'll go to them. When the sugar really starts to go low, there could be erratic behavior, confusion, inability to concentrate, and they can even look like they're, on drugs. Treatment for low blood sugar is having carbohydrates. It's important for them to carry a snack, glucose tablets, candy, or juice. And any diabetic that I've had in school, there's always a supply of snacks in my office for them, in my refrigerator. Treatment for as I mentioned, treatment is carbohydrates. If they are low, they'll have the snack. The amount of carbs is usually determined by the treating physician. The student stays with me for approximately 20 minutes. They will test again, and I will send them back to class once the blood sugar level is normal. If the student's blood sugar is high, then I encourage them to take laps around the school and drink water. Occasionally, they might have given too much insulin, maybe they ate too little, but that usually brings it down. There are several different devices that deliver insulin. Insulin pump, which I think most people use, a pen, and syringes, which I actually know some people that still do that. Currently, there's one type 1 diabetic in school here at Wheatley. I'm not sure about Northside or Willits. He is extremely independent with his care, and I can let you know who it is if you want to know. Okay. Next, I'm going to talk about EpiPen. Here at Wheatley, we have approximately 77 students with an allergy that could require an EpiPen. There are many triggers. Food, such as peanuts, tree nuts, milk, apples, kiwi, mango, shellfish, soy products, medicine like Motrin, Tylenol, penicillin, and other antibiotics, latex and gloves, Band-Aids, bee stings. Reactions can be mild or severe. They can get itchiness around the mouth or on the tongue, coughing, shortness of breath, tightness in the back or the chest, swelling of the lips, throat, tongue, and general face area, hives, rashes. They might feel weak and look pale. Hopefully I'm called, before they have those symptoms. I would go to them, or they'd be brought to me. I would determine if they need an EpiPen or not. The first thing I would do is have them lie down, because once you give the EpiPen, they can feel very shaky, and it also flows to the heart and through the body a lot better when they're lying down. So I'm going to demonstrate how to use it. Okay, this is a typical EpiPen container. Open that up. Take it out. It has a cap on it, and there's a needle in here. When you give it, you can give it right over the clothing, preferably in the thigh, where it's meaty. Take the cap off. Take the cap off, and then jam it literally in the thigh for like 10 seconds. And count to 10 so you know the medicine went in. And then take it out. It'll cover up the needle so they don't have to see it. I would call 911 right away, even before I gave the EpiPen. Sometimes they like to have the container to see if all the medicine got in or not. Anybody have any questions so far? Anything? No? Okay. There are different EpiPen devices that are out, that some have been out for a long time. One is called an AviQ, and it actually talks you through it. It's also nice and small, could fit right in your pocket. And basically, you just take the top off and it starts to talk.
This trainer contains...
Whoop. It does talk you through the process. Thanks.
Go.
Thank you. And then there's a generic, that comes in a box like this, and it looks very similar to the first one I used. Okay. Next, I'll talk about epilepsy. Okay. Epilepsy is a seizure disorder. The word epilepsy is a general term that refers to 20 different types of seizure activity. It's not a mental illness. It's a neurological condition that causes unusual nerve activity in the brain. Currently, we have 2 students at Wheatley that have a seizure disorder. Seizures can cause a range of symptoms from staring blankly to loss of awareness and uncontrollable twitching. Some seizures may be milder than others, but even minor seizures can be dangerous if they occur during activities like swimming or driving. Some people know when they're going to have a seizure. They might have what's called an aura, or a sensation that one is coming on. There could be lip smacking, chewing, rapid blinking, seeing bright lights, hearing voices, smelling something, or feeling anxious. It can be their signal. It can be very scary when seeing a person having a seizure. So what do? If the person is sitting or standing, when the seizure begins, you want to try to get behind them and lower them to the ground, where they'll be the safest. If they're having a seizure, while they're standing, of course, there's that risk of them really hitting their head. Put something under their head when they're lying down, and keep in mind the person is unconscious. They don't realize what's happening, so you want to keep them safe. Call for help. They could be drooling. You want to turn them on their side. Clear, if it's a classroom, I always instruct the teachers to, clear the room, get the kids out. You want to maintain their dignity, move furniture if needed. Never restrain the person unless they're going to, really hurt an extremity or their head. And if possible, note the time. That's really important, and how long it lasts, because sometimes there's a medicine that can be given to stop it. There's a medicine called Diastat, which is given rectally, and one called Valtoco, which is a newer one. And it's like Narcan, where you give a spray up the nose, and it really does work. Also, if possible, note, like what the specific body movements are. I know it's scary and that's the last thing you're thinking of. The cause of a seizure activity is unknown. Some common causes can be a high fever, like febrile seizures, low blood sugar, stroke, brain tumor, or concussion. Just want to mention for bus drivers that if a child has a seizure on the bus, pull over, lay the child down in the center of the bus on the floor, try to protect their head, arms, and legs, stay calm, and wait for it to subside, and the child becomes aware of their surroundings, call 911 and the school, and wait until help arrives. Okay, one more. All right. Next. Any questions or anything about that? Okay. Bleeding emergencies. Unfortunately, the possibility exists that could be a school violence, a shooting, or other act of violence in the school setting. The potential for a bleeding emergency exists, it's real, and we should know how to deal with a wound until help arrives. Also someone, can fall off a ladder and cut, their leg, their arm, anything. So I'm just going to demonstrate what to do if you need to stop the bleeding. So we're going to pretend this is somebody's arm. And you want to put on a tourniquet? Can you hear me? You want to put a tourniquet on to stop the flow of blood. So, hold on a minute. Couple of things. It's only used on limbs. You want to first apply pressure to see if the bleeding stops. You can use a towel, a sock, anything at all. You want to really, press hard. If it doesn't stop, you want to put the tourniquet on. And the tourniquet is going to be put above the wound, about 2 to 3 inches, closest to the heart. So if I have a wound here, we're going to put the tourniquet on here. So I'm going to show you what to do. You're going to tie it around the arm, tight, and tie it again, if you can. Try to find something, a pencil, anything that's long and firm, and you're going to put it underneath the tourniquet. The key is to stop the bleeding. I mean, they could literally bleed out and, die. So what you want to do is you want to turn this as tight as that tourniquet will go until it stops. It's going to hurt like hell, but, it's going to save their life. So, that's more important. And you just want to keep it there until help arrives. The other thing is that there's a tourniquet in all the AEDs in school as well. It's a real professional tourniquet. That's it. Is there any questions or anything else? No? Yes?
What else can be used as, if you don't have a legitimate tourniquet, what can you use to tie it off?
Shoelaces, literally. I mean, I know people don't usually wear a tie anymore. A sock, our lanyard can be used. Anything at all where you can tie it tight and then tighten it even more if possible. Yeah. Thank you so much.
or educational environment, even if the complaining individual is not the intended target of the sexual harassment. Sexual harassment can have no more sexual advances, praise, and other verbal, nonverbal, or physical conduct of a sexual nature, or verbal, nonverbal, or physical aggression, intimidation, and hostility that is based on actual or perceived gender and sexual stereotypes. Examples of sexual harassment can be found in the accompanying regulations for the which you all have access to on the website. Any person who believes he or she has been the target of sexual harassment by a student, district employee, or non-employee, or third-party related to the school is encouraged to report these things as soon as possible and in order to enable the district to promptly and effectively investigate and resolve the complaint. Any person who witnesses or is aware of sexual harassment of a student, employee, or non-employee is also encouraged to report the incident or behavior to the district. Targets are encouraged to submit the complaint in writing. However, complaints may also be filed verbally. The complaint form is listed on the district website. If you receive or witness any form of sexual harassment, please reach out to either building principal or Diane Costanzo, the deputy superintendent at the Title IX Compliance Office. Reports can be made in writing or verbally. We'll file the investigation and resolution procedure outlined in the East Boston Board of Education relevant policies contained here on the website. Questions can be submitted to Mr. Stanway at his email or his phone number. Taking false feedback or gossip. These are some examples of things that have affected students who are impacted by bullying. What is this act? The Dignity for All Students Act. The law that was adopted in July 2012 states school districts are required to prevent, monitor, and address bullying through staff training, sensitivity and tolerance curriculum, revising our code of conduct to make sure that the school maintains a discrimination-free environment, and district that reports to the system. I got this right here. Who needs to be trained? Everybody. No. What is harassment? The Dignity for All Students Act defines harassment as the creation of a hostile environment by conduct or by threats, intimidation, or abuse, including cyberbullying that have or would have the effect of unreasonably substantially interfering with students' educational performance, opportunities, or benefits, or mental, emotional, and physical well-being, reasonably caused or would be reasonably expected to cause a student to fear that their physical safety, reasonably causes or would reasonably be expected to cause physical injury or emotional harm to a student, or occurs on school property and creates or will create the risk of substantial disruption within the school environment, or the infringement upon another's rights, where it is reasonably foreseeable that the conduct, threat, intimidation, or abuse might be school property. So what that basically is the nexus. If something happens outside of school that could impact the child in school, we have to take action. Characteristics, actual proceed, anything that targets but not limited to these different aspects of a person, things that they can or cannot control, must be addressed. The student must be protected, and we have to ensure that they are appropriately addressed. What is bullying? In bullying is an imbalance of power. Students who bully use their power to continue to strength, access to embarrassment, or popularity, control, or harm others. The students who, in seeking to make themselves feel better, make themselves feel more powerful, utilize information that they have or their social presence to make other students feel uncomfortable. They intend to cause harm, physical or emotional, embarrass the child, and make them feel uncomfortable. This can come up in the cafeteria if you hear students making light of strong things like students' appearance, their religion, their race, their characteristics. It can be something that's repeated over time, but it does not have to be. A single instance can also be verified as bullying. What are types of bullying? More traditional bullying. Physical, punching, shoving, verbal bullying, name calling, indirect bullying, again, spreading rumors, especially on social media. Cyberbullying. This is sending messages via text, the internet, that sort of thing. Responsibility for students. The student should strive for a good relationship with faculty. The student is responsible to contribute to a positive school atmosphere free of arrest or intimidating behaviors. Students are encouraged to support any other student who seems victimized by telling adults or reporting it anonymously to repel something more on a different website. Staff is responsible for providing ongoing testing programs that promote the reduction of harassment and bullying behaviors. Staff should be aware of any aggressive behavior in their classes or in their presence and should take appropriate and immediate action against it. The staff is responsible for aiding students who are having difficulty in peer relations. Staff should strive for a good relationship with students. We should model appropriate behaviors to be respectful towards each other, and we should be kind to students as well. And the restorative justice, you would engage in this. If you see something that's not acceptable or not appropriate, we need to make sure we're addressing it through restorative conversations, restorative circles, to help the students see the harm created by their actions and how they can improve it. In addition, if you hear something, make sure you say something. Make sure you reach out and share. How do you do that? Staff members observing an incident should immediately react. Stop the behavior if you can. You should be able to report it to the school principal or the guidance department. Staff member must prepare a written record in detail and report form. There are reporting boxes in each of the school main offices and the nurse's office. Students can also
All right. Do I have to talk on a mic? I guess I do. All right. All right. So this is the really thrilling acceptable use policy slide deck. It's going to take me 4 minutes to do. I promise you. Short-lived. Those, you like that? Nice and quick. Half of you I don't even want to use a computer anyway, so that's fine. All right, well, anyway, so I'm Corey Kinderman. I'm the Chief Technology and Innovation Officer, if you didn't know that. I'm excited. I wanted that phone. Who broke the clicker, by the way?
Not me.
All right. Talk to the tech guy. So I'm the Chief Technology Innovation Officer for the district. Super excited to be here. Any and all technical issues you guys have, come to me. I promise you I'll fix it to some extent, or hide, run away. I'm in the IMC if you need anything, but excited to be and work with everybody. So real quick overview, what acceptable use policy actually is. So the purpose of an AUP, ensure the responsible use of district technology and internet resources, protect our students and staff and the district systems, and aligns with NICED regulations and data privacy laws like Ed Law 2D, CIPA, and FERPA. So the expectations of you and the students aligned alike, the use of technology for educational purposes and professional purposes only. Protect your login credentials, never share your passwords. Again, these are all obvious things. Respect the digital property. Don't tamper with the devices. You have any issues, come talk to us, any of the tech team. We'll be happy to replace it, help you guys out. Want to make your lives easier, for everybody else's lives easier. Communicate responsibly using email, any of the G-chats or any of the other chat collaborative tools. You know, this is for the kids at the bottom, but always credit the sources and avoid plagiarisms. Access any of these prohibited behaviors. You know, please limit what you do on these devices. Again, they're school issued. You know, we're all adults here, so, and I'm sure you guys have the same mindset. But accessing or sharing any inappropriate or offensive content, can't do that. Attempting to bypass security filters. There are a lot of different techniques and different ways that we could find these things out. You know, if these things are being used. And again, the culprits really aren't the staff, they're the students. But the main way we could find out is that it breaks. More than likely, if something's not working correctly, it's either because the person before you might have tampered with something. So if you have issues, just bring it to us. We'll make sure that we can fix it. Obviously, for the kids, but also some adults, no cyberbullying, harassment, disrespectful online behavior. Don't download anything onto these. If you need something for your specific job, we're happy to install that, have that set up for you, so just let us know. And any of the district accounts, devices for personal business or legal activity. You know, we're at work. You know, don't get in trouble. That's the easy thing. Data privacy and security. So the district complies with New York State Ed Law 2D, which basically helps keep your PII, personal identifiable information, safeguarded, and the students as well. You know, many of your roles, you're passing data back and forth. You know, you may be helping purchase something for a vendor, maybe you're helping a teacher work with, you know, class lists. If you ever have a doubt, just don't do it and talk to me. Talk to one of my staff members, ask me. If you're ever uncomfortable with sharing any of that data, there's so many different regulations and restrictions now. I'm happy to answer some questions, and that's really why I'm here. So don't feel the pressure that you have to do it, just come to me and I'll help find the solution for you guys. Email and cloud tools are monitored. Everything that is used within the district, we have to keep tabs on it, you know, because we just want to make sure that there is nothing malicious coming in. And some of you might be surprised that goes with, you know, a lot of the tools that are being used in the classroom for educational purposes, but even some of the hardware that we use for our infrastructure, our heating and cooling systems, our printers, our scanners, our faxes, you know, anything that really connects to the internet can be compromised. So, like I said, if you have any questions about stuff, just come talk to me in my department. We're happy to help you out. Report any suspicious emails, links, or activity pretty much as quick as you can. You can find my email, you know, just look up Corey. You know, Kindleman's my last name. I tell you what my email is, but it's a 10-letter last name, and you don't have to memorize it now. But reach out to me immediately. Even if you feel like it's foolish, I do not care. I would rather you know, be cautious instead of clicking on something and not knowing, you know, where it's going to take you. Because in the end, I want to make sure that everybody's information is safeguarded and the district doesn't have to deal with any compromised accounts. Any of your devices that you bring in, you're more than welcome to register and to log in. So we reconfigured our Wi-Fi networks. The guest network is going to turn on at the end of the day around 3 o'clock and then go until 10. And that's a network that the students are going to use. But you as staff members are able to use the EWBYOD account. And you basically just use your Google credentials to sign into that, because we know the service is not great here in East Williston. So if you need, you know, you want to do iMessage or you have an Android phone, you know, make sure you guys sign into that Wi-Fi. That Wi-Fi is monitored, and a big question that always comes up is, you know, tech is spying on me. They're looking at my stuff. Not true. We do not care. You know, we just want to make sure that the network is safe, so you could utilize that network on your phone. We don't see anything that you guys are doing on that. If you are on a district-owned device, that we can monitor and that we can ensure that it's safe, you know, back and forth. But any personal questions, if you guys want to ask me, I'm happy to answer all of that. And then staff responsibilities, model proper digital citizenship. That's just utilization of technology. You know that here at the high school specifically, but really district-wide, no cell phones. Cell phones are banned now, New York statewide. Computers really are only the school-issued computers. So a lot of that modeled behavior, if our kids don't have our phones, we're going to try to limit our phones as much as we can. I'm not expecting everybody to do that, that's in the room, but, just looks good for the kids because, they can't use it. They're always going to point a finger and be like, well, why are they using it? So I'm like, when you get older, then you can figure it out. Monitor some of the student activity during tech use. Keep an eye. You have a question, see something, say something. Just let me know, because more than likely these kids are smarter than all of us, and including myself. They find ways around my filter. They find ways around our firewall and different ways to get onto technology. So I want to ensure that we keep things safe. So if you see something that seems fishy, more than likely it is. So just let me know. Try to reinforce these, in your roles specifically, and with your colleagues, and just make sure that everything, kind of stays close and safe. Because I have dealt with, breaches in districts, and it's not fun. So the safer we can be on the back end, make sure everything's secure. I want to do the same thing for you guys and the staff. And that's really it. Any questions? Look at that. See, how quick did I do that? Like 6 minutes. I think I did pretty good. So, right. I get kudos. I was 8? All right. Damn. Good timing. Thank you. Thank you for that. All right. So no questions. You all feel safe. I like that. You're all trained in acceptable use policy now. I don't know who is next. Who's next?